Angel. Today we are going to talk about congenital toe syndactyly. Okay, it's also called as web toes, right? All right, so syndactyly occurs when fingers or toes don't separate properly during fetal development. Most common type is simple syndactyly, where the digits are connected by the skin and the soft tissue. So there you go. The digits are connected by the skin and the soft tissue. Webbed toes may not affect function or activity level, but surgery can correct them if the condition restricts activity or causes discomfort. They can also be corrected for cosmetic reasons, right? So they can be corrected for cosmetic reasons. There is no issues with regards to walking or running or anything like that, but they do look a little different, right? You can actually see that they're two conjoined web toes and they're not very pleasing. What causes web toes when a fetus is developing in the uterus? Its fingers and toes are fused until about 6 to 8 weeks of gestation. The tissue connecting them begins to die off, so the digits separate in most cases. However, in some fetuses, tissue remains, which results in web toes or fingers. Web toes are primarily a cosmetic concern and generally do not adversely affect walking, running, so your functionality is not going to be impacted. You can swim, walk, and run very easily. Since your big toe controls power and the balance of your gait, a few second and third toe can function as a second big toe, preventing athletic advantage, providing an athletic advantage, right? So it provides an extra support, right? On the other hand, movement of fused toes may be limited, impacting balance and causing problems with activities needing prehensile toes, right? So wherever you have any activity where you actually need your toes, right? That's when you're going to have issues, right? Because you won't be able to do those functions very often. Okay, web toes can associate with Down syndrome, a genetic syndrome that can cause unusual development of the bones in the hands and the feet. Down syndrome is a genetic disorder that occurs when a person has an extra copy of chromosome 21. It is also known as trisomy 21. So as you can clearly see, the patient here has web toes. You can actually see malformation of toes, right? So web toes are common with Down syndrome patient. All right, so having web toes is actually very common. Many people have web toes. It happens more in males versus females, right? So this is Ashton Kutcher. I'm not sure, but he actually showed once on TV that he has one web toe, right? Something different. So syndactyly is common, affecting about 1 in every 2 to 3,000 newborns. It's more common in boys than girls, right? Surgery is a treatment for syndactyly. It's called as desyndactyly, okay? And it usually takes place when a child is between 1 and 2 years old. After surgery, a child may need occupational therapy and home exercises to help with the recovery. Syndactyly can affect any two or more fingers or toes. So syndactyly is not just toes. At times, patients may come in with issues with regards to their fingers as well. So it can not only impact your lower extremities, but it can also impact your upper extremity. But it most often occurs with the middle and ring fingers. It can also affect the thumb and the pinky, right? So this is just upper extremity. All right, syndactyly can be hereditary, right? But not all family members may be impacted. It can also be related to genetic defects such as Crouzon syndrome and Apert syndrome. So Crouzon syndrome is a rare genetic disorder that causes abnormal fusion of certain bones in the skull and the face. As you can see, there is an abnormal fusion, leading to characteristic facial features and other health problems. Crouzon syndrome is caused by mutations in FGFR2 gene, which plays a role in bone and growth development, right? So as you can see, there are some certain issues with regards to, certain bones in the skull and the face, leading to facial features and other health problems, right? So as you can see, the bone development is uneven. As you can see here, the bone development is uneven, right? So look at the oral cavity here, and you can see the face and then the structure. This is Apert syndrome. Apert syndrome is a rare genetic disorder that causes the early closure of skull, right? The skull closes early on during the development phase, embryonic development phase. A closure of skull sutures, right, resulting in a variety of deformities of the skull face, hands, and feet. Apart syndrome is caused mutation of FGFR2 gene, which provides instruction for making a protein that signals immature cells to become bone cells, right? The abnormal signaling causes the cells to mature too quickly, leading to premature fusion of the bones, right? So abnormal signaling causes the cells to mature too quickly. And that's why, as you can see, the patient has webbed toes, fingers, abnormal suture closing, and look at the palate here, the oral cavity. You can actually see that it closed early on. Signs and symptoms: besides the visibly fused toes, there are no other signs or symptoms of this condition. The patient can walk and run properly. The doctor will diagnose it on general examination by examining the fused toes. The doctor will perform a complete examination uh, to rule out any associated syndromes with webbed toes, such as Down syndrome. Right? Investigation: the doctor may order a few tests to see the extent of the fusion and to see if the bones are separate or fused. These tests may include X-ray, CT, or an ultrasound. So surgery to separate the toes is usually performed when a child is between 6 months and 2 years old. The procedure involves anesthesia. The child is put under general anesthesia, so they are asleep and don't feel pain. The surgeon marks the skin that needs to be repaired. The surgeon cuts the skin into flaps and separates the soft tissue between the toes. The surgeon sews the flaps into the place. Skin graft, if needed, surgeon takes the skin from another part of the body, so that's an autograft, to cover areas that are missing skin. This is called skin graft and is usually taken from the elbow or the wrist crease to minimize scarring. Bandaging: the foot is wrapped with the bandage or cast to keep it from moving while it heals. All right, so as you can see, this is A, B, C, D. So this is what you call the Z-plasty. There will be a cut right here. It will be separated. A skin graft, the autograft will be taken and just pressed into the two different flaps, right? So there you go. So there is less rejection of the autograft, right? So you're taking your own skin and placing it on your own skin. So it, the chances of your body rejecting a skin placement would be less, right? All right, so this is the animated version of it. As you can see, there's a flap. And let's see the live pictures. Okay, so they do provide general anesthesia that may cause a little bit of clotting. So as you can see, there's a little bit of clotting. Here's where the surgeon has cut right here, right? As you can see here, they cut here. So this is exactly what they do. They would take a precise flap, a skin graft from your own foot, and then just place it. They would just stick it in and then sew on all the sides, right? So that's what they're doing. They are placing the skin graft. They've placed a cut, and now they're placing the skin graft inverted. As you can see, it's inverted, and then they'll start suturing it. Right, so as you can see, this is a perfect sutured skin graft. All right, so now they will be closing the skin graft, that the place where they took the skin graft from. All right, so as you can see, this is a this is a subcutaneous graft, right? So all they have to do is just pull it and it will close on its own, and all you have to do is just tie on the ends, and that's it, we're done. All right, as you can see, they just pulled the skin together, tied it on the end, and that's it. The skin will heal on its own, right? So as you can see, the patient came back. There's a little bit of inflammation, right? As you can see, there's an inflammation. It looks pressurized. It does not look okay, but nothing that, it cannot be fixed. I don't think so. It's that bad. It's just that it is a little inflamed, a little pressurized. It looks like, the sutures were kept for a little longer than average time because it doesn't look like it's properly done, right? Okay. All right. So after the skin graft that was taken from here, as you can see, is healed. Okay. And this is completely healed now. So the toes are separate and everything is fine. The skin graft did not have any rejection. We just had inflammation and we completed it, right? So there are different type of syndactylies, and the complexity of surgery depends on the severity of the condition, right? Simple syndactyly involves separating skin only, right? So all you did do is put a cut in the middle and separate the skin, suture the skin on both the sides, and we're done, right? Complex syndactyly involves separating fused bones, nerves, and blood vessels, right? Because at times you may also have a bone and or nerves growing to supply that area, and that kind of becomes complex, right? Multiple digits, if more than two digits are joined, the surgery will be more complex, right? Especially the two digits are joined on digiti minimi, that is even more complex because you're dealing with a very less space in the digital minimi, the pinky toe. Okay. Bone fusion, if the digits are joined at the bone, the surgery will be more complex because now you not only have to, remove the extra digit, but also the bone. And that includes that you will need extra support. Yeah. The separated toes will never look or function the same. When joined fingers share a single fingernail, it's rarely possible to create two normal looking nails. Okay, so they're talking about fingers, but the same applied to the toes as well. You can never make it look like it's the same, right? Because you're sharing, the same nail. So, okay. Surgical complication. The complication can be bleeding from the wounds, right? We just saw there was an inflammation. Careful surgical procedure prevents this. Infection of the wounds, good hygiene prevents this. Formation of the clots. Clots may form in a surgery. For this reason, in susceptible patients, uh, prophylaxis is given, right? Thromboprophylaxis is a medical treatment that prevents blood clots from forming in the lungs or legs. It is used for people who are at high risk of developing blood clots, such as those undergoing surgery or with cancer, right? Now, what can happen? Other things in the surgery, graft failure due to inadequate blood supply to the skin graft. It may wither off or die. It will just die. In such case, another graft may have to be fashioned and places with making sure that it gets a better blood supply, right? So in such case, another graft may have to be fashioned, may have to be placed on top of it. All right, so numbness. Some areas of numbness in the affected toes after surgery are a normal occurrence as the nerves may get damaged during the surgery. Stiffness of the joints. This may occur after a few weeks due to inactivity and immobility, and it may require physiotherapy to solve these issues. The cast and bandages used after the surgery completely immobilize the joints, giving the surgical wounds a chance to heal. This lack of activity may cause the stiffness, right? So stiffness of the joints, this may occur after a few weeks due to inactivity and immobility. You're not moving, doctor asks you to stay steady, and that may cause issues with mobility. So the corrective surgery for the fused and syndactyly of toes has very high success rates. I mean, um, if the toenails were fused as well, the shape of the toenails may not be completely normal and often can differ from the uninvolved toes after surgery, so that there is a chance. Although rare, it is possible that some patients may require additional corrective surgeries after, right? We just said, what if the graft fails? What if we have bleeding issues? What if we have joint mobility issues? You may need extra therapy session, etc., etc. It typically takes a month or so before the patient can begin to put pressure on the separated toes, and 3 to 6 months before they fully heal from the surgery, depending on the extent of the procedure. All right, so that was, syndactyly. If you have any questions, if you want to make a comment, go ahead, like, subscribe, share with your friends, and you can watch this video to learn as much as you can. Bye.